Genital herpes affects 1 in 5 Americans, and it is the most common sexually transmitted disease in the U.S. But as Fox 6's Jennifer Brandt explains, there's new hope.
Come on, come on. Come here, sweetheart. Oh.
My babies. Yeah, she's one of the healthiest, smartest babies.
Like any mother, Maria is more than happy to brag about her little girl. But it wasn't long ago that she thought she may never even be able to have children. Maria was diagnosed with genital herpes. She agreed to talk to us as long as we concealed her identity.
I was afraid because, how is this going to affect, being able to have sex? How is this going to affect relationships? How is this going to affect, being able to have a healthy pregnancy and birth? And it was devastating. It was really scary.
There is no cure, and the dangers for women include the risk of passing the virus onto their baby during pregnancy.
Blindness or brain damage, so it has a great deal of consequence.
Currently, antiviral medications are used to shorten the outbreaks. That would have been the treatment Maria used had she not met Dr. Leon Silverstone.
I'm a pathologist and neuroscientist, but I suppose really I'm an inventor.
The doctor's latest invention, this pager-like device called ViraCalm.
It emits a unique series of electrical bursts and waveforms and frequencies, and what they do is they resonate with the tissues in the body, and as a means of enhancing the energy of the tissue, so therefore they can help in healing themselves.
You hold the ViraCalm against the outbreak for 30 seconds every hour. You do it 10 times, then throw it away.
It's painless. Often you feel nothing. Sometimes you feel a very slight tingling. But the nice thing is that by the following morning, the outbreak tends to go into its healing phase.
It's really, really simple and really easy.
And at least in Maria's case, it worked. She says she hasn't had an outbreak since she used the device 3 years ago.
I feel normal, pretty much. I feel normal again and healthy.
A healthy mom with a very healthy baby. Jennifer Brandt, Fox 6 News.
And Dr. Leon Silverstone joins us this morning to talk a little bit more about this. Thank you for coming in to Fox in the Morning.
Oh, my pleasure. Good morning, Desiree.
First of all, you did bring the device with you, and my first question was, because I know that there are drugs to help treat this. This is one option, but doesn't it seem like some people might think it's a lot of work, more work than just popping a pill or doing something like that? I mean, what are the benefits in your mind about doing this?
Well, you're right. We are a pill society. But if you look at the antiviral drugs, even if you take the drug early to treat an outbreak, then studies have shown that even though the outbreak can be 1, 2, or 3 weeks, the drug is only likely to reduce the outbreak by 1 single day. Now, and of course, drugs also have side effects that are undesirable. Now, with the device, it's non-invasive treatment. There are no side effects. And a 30-second treatment is simple. You simply press the little button on the device, hold it against the outbreak, 30 seconds is all over, and you feel nothing. Sometimes you might feel a teeny tingle. And you repeat this 9 further times, an hour apart. And by the following day, in most cases, the lesion starts to heal up. And therefore, you don't have that period of 2 or 3 weeks when you're highly infective and you have very, very painful ulcers in the sensitive areas.
Now, it sounds like a great idea, and I'm just wondering how many people have used this so far, and how much do you have in terms of research on it?
Well, we've got more than 10 years of research on it. The team has done clinical studies to make sure that we have the right outputs, but we haven't yet had regulatory approval, and we're about to go into clinical trials to prove in an unbiased manner against dummy devices that the device is very, very, very effective.
Now, let's talk a little bit about herpes as it pertains to pregnant women, because in a lot of cases, people that have herpes don't realize that they have it, especially women, because, excuse me, all of the organs are internal and that sort of thing. And so how does this affect pregnant women, and why is it so important?
Well, this is why it's so devastating, because more women get genital herpes than men. And in fact, 25% of all pregnant women have genital herpes. And if you suffer with the virus, then 80% of all sufferers are likely to have at least 1, maybe up to 3 outbreaks during their pregnancy because their immune system is lower.
Okay.
And the consequences can be devastating. It can be anything from rashes to blindness to brain damage or even death of the newborn.
Oh, wow. Okay,
Yeah.
so very important that people be aware of that, especially pregnant women. Now, we talked about this device, this particular device that you're holding being for genital herpes, but a lot of
Correct.
people have oral herpes, and you do have something that you've invented for that as well.
Yes, indeed. It has a different appearance. It looks like a lip moistener.
Did you bring it with you?
I have.
In your pocket.
As it so happens, I have it with me.
Very good.
And it looks like a lip moistener.
Let me hold this up here.
Yes. And so therefore, there's no stigma if you take this out and use it on your lips. And in this case, the exposure is just 10 seconds. So 10 seconds, about once an hour. And after the 10th treatment, you just throw it away. And although oral herpes or cold sores are not as devastating as genital herpes, nevertheless, they're a real nuisance factor. They're unsightly, which is more bothersome in women. And you can spread the disease even when you don't have symptoms. You can spread it by kissing.
We should mention there is no cure for this. I mean, the outbreaks can occur whenever.
You have the virus for life, but the important thing is, if you have genital herpes, you're much more vulnerable to the HIV/AIDS virus. And in many countries, the increase in genital herpes is fueling the spread of HIV/AIDS.
All right. Well, Dr. Silverstone, we appreciate you coming on this morning to talk about this. Great breakthroughs, great inventions, and if this actually becomes something that people start using, I mean, there's no I mean, there could be a great breakthrough in medicine for people with herpes.
We certainly hope so.
Thank you so much.
Thank you.